If there's one thing these early years of the 21st century have taught us, it is that virtue signaling pays, as long as you're on the right side of the issue. The saccharine cry, think of the children, is omnipresent in American political rhetoric because it works, forcing politicians and bureaucrats into a corner, leaving little room to regulate in favor of the adult population, which seems to be exactly what is happening when it comes to vaping. Joining us today to discuss what appears to be a momentous moment for vaping in the U.S. is Dr. Raymond Niaura, Interim Chair of Epidemiology of NYU College of Global Public Health. For 8 years, Dr. Niaura served as Director of Science and Training at the Schroeder Institute for Tobacco Research and Policy Studies at the Truth Initiative, where he also supervised the pre- and postdoctoral training programs. Dr. Niaura has previously taught and conducted research at Brown University, Johns Hopkins Bloomberg School of Public Health, the Georgetown Medical Center, and the School of Public Health at University of Maryland. He was also a former president of the Society for Research on Nicotine and Tobacco and is a deputy editor of the Nicotine and Tobacco Research Journal. Dr. Niaura, thanks for joining us today on RegWatch.
Great to be here, Brent.
So let's just first get right to it. This is the question that's on everyone's mind. Is teen vaping really an epidemic?
Well, it depends on how you define an epidemic, which is actually not, as far as I can tell, doesn't have strict guidelines in terms of definitions. But it has been declared an epidemic by no less than the Food and Drug Administration and the Surgeon General of the United States. So, by their account, it is an epidemic. I think what they're reacting to is data information that came out late last year about vaping rates here in the U.S. among youth, kids in middle school and high school. And there was definitely an uptick in vaping, which they interpreted to mean that there is an epidemic.
So when the largest public health agency in the world, possibly outside, I guess, of China, uses the term epidemic and clear and present danger, aren't these the terms that FDA and CDC would use for yellow fever and Ebola?
Yeah, and you bring up Ebola. It's raging in the Congo right now, and that's an epidemic. But the term has been intended to include not only diseases and disease categories, but pretty much any kind of behavior. So I think they're just taking advantage of the loose definition of epidemic.
So what are the most recent stats then for youth use in the U.S.?
Yeah, so this is the latest data that was released, 3 months ago by the CDC, and this comes from the National Youth Tobacco Survey, which is sponsored by the CDC, and it's conducted every year here in the United States. How the CDC typically breaks down this information, so they talk about the past 30-day use. So those two numbers are similar. Well, the blue bar for past 30-day use is similar to what we saw in the previous slide, and then you see the uptick from 2017 to 2018, so going from 7.9 to 13.5%, and that's the increase that has gotten people pretty concerned.
From a researcher's point of view, granted, fair enough, you've collected this data, this is great data, but the public is only hearing about this 7.9% jump to 13.5. They're never seeing this never use, these two bars, which are massive, and you go, oh wow, never use, that's huge, common sense starting to trickle in. And then when you see past 30-day use, and then infrequent use, and then frequent use being like so low. Well, boy, if the public saw that, then they would have a chance to then kind of evaluate this for themselves. But instead, FDA says it's epidemic, the researchers only push the 30-day, the media only gets the 30-day, and then the 30-day number that's the only part of this chart that makes it to the public. Whereas if this whole chart did, reasonable adults could then form their own opinion.
Right, and if you go to the next slide, this is the same data just chopped up in a bit more detail. And, this is how the questions were asked, on the survey. And, it just gives you a better kind of sense of, where the increases are occurring. And again, there's across the board, increases in use, but, the numbers, start to get low when you look at more frequent use. The thing that, you mentioned, this is not what the public gets to see. And frankly, this is what was annoying and frustrating by the, back in the fall when the FDA and the CDC and the Surgeon General were saying it's an epidemic. We researchers didn't have access to even this information at that point in time. And, we're an obsessive compulsive bunch. We like to, slice and dice and dissect and look at everything and kick the tires for ourselves to convince ourselves that, we understand what's going on. And, I have to say, and, no offense to the FDA or the CDC, or the federal government, but, we don't take things, on trust. That's not how science works.
As a public health and tobacco use scientist, I too share concerns about youth tobacco use, including vaping. For the record, I believe no youth should be using any tobacco or nicotine-containing product, or any drug for that matter. We should do all we can to discourage youth use by providing appropriate education and counseling, and by making it difficult to purchase such products. During the fall of 2018, the FDA and the U.S. Centers for Disease Control and Prevention expressed acute concern about youth vaping when they looked at data from national surveys. And this prompted Dr. Scott Gottlieb, who was the FDA commissioner at the time, to declare that youth vaping is an epidemic. This concern was reinforced by data coming from the National Youth Tobacco Survey in 2018. When the data were eventually released to the public, we looked at it ourselves, and we can indeed confirm that past 30-day vaping had increased from the prior year. We also looked at youth who had never used tobacco products, and thankfully, vaping rates were quite low.
30-day use, is this an accurate measure?
Well, for good or bad, it's a measure that we're kind of stuck with. And it's largely historical because this is how people constructed the survey questions way back when they started to pass tobacco use. It's not ideal. How do you measure exposure to vaping? How do you measure vaping use? The products are not used the same way that cigarettes are. They're very different. And I don't think the research community has been able to adequately, rise up to the challenge of figuring out how to measure, this kind of behavior. People are working on it, but it's very tricky because it's not something. These are not cigarettes. People don't use them like cigarettes. So we kind of have to rethink our paradigm. And hopefully going forward, we'll get better surveys.
So do you think then American Cancer Society, Campaign for Tobacco-Free Kids, Truth Initiative are out there banging on the doors of FDA and CDC to change the way that they're doing their measurement and remove 30-day use? Or could we assume that they like the 30-day use because it's a bucket that just creates a huge number?
Well, I don't know if they're banging on anyone's doors. I think they just go with what's out there. And, they're happy with, surveys that, kind of as they are. And, speaking as a scientist, I pointed the issue out. I think we actually have crappy measures of behavior in these surveys, and that's a problem because if we're going to make, public policy and rulemaking at the federal level about these issues, we have to kind of have, a better handle on the behavior as it's occurring in the real world, and I don't think we do.
Let me draw your attention, Dr. Niaura, back to your presentation, slide 5, smoking in the youth in USA, 2017, 2018. And again, it's shocking, the smoking, frequent smoking went from 1.1% to 1.2.
Yeah, so statistically no different.
And even at that level, it's almost statistically undetectable.
Yeah, it's super low. And again, I keep telling people there's good news in this data, and we shouldn't overlook it. So, we don't have to credit vaping for this. I mean, I think there's been a lot of stuff going on that has, turned the tide in terms of youth cigarette smoking, and we should celebrate that and say, we have been making progress. So this is good news.
When you look at slide 8 here of your presentation, this really demonstrates an entirely different perspective on the so-called epidemic, does it not?
Yeah, well, this is again why it's important to look at data yourself, or at least, if you have a good friend who's a scientist, to get together and start analyzing some data. So here, this is the same study that we were looking at before. This is 2015 and 2018 data. So these are the naive kids.
Right.
And you look at how, what they're doing in terms of vapor products. These are the numbers. You can see that, there's a chunk of them who, are trying these products, the 1 to 2 days or 3 to 5 day users. But then once you move on up beyond that, the numbers dwindle rapidly, and there are very, very few people who are naive, who are, starting to use these products.
So this is the heart of the gateway argument, though, is that kids who have never smoked are going to become vapers. Does this data not completely shatter that?
Well, so there's two parts to it. One is, are these never users using these products at an alarming rate? I would argue based on these numbers that the answer is no, but they may be cause for concern for some people. I don't want to minimize or dismiss that. The part 2 of it is whether these kids, because they've tried these products, are at greater risk of actually then going on to become cigarette smokers. We don't know that from the National Youth Tobacco Survey. You can't really tell from this kind of information. And, there are a bunch of studies out there that, claim to be able to say, well, we've found a gateway. There is a small association between, using a vapor product at, one time, and then later on in time, the risk is higher of using a cigarette. But, so there's something going on. But to actually say that that's what causes, is the ultimate cause of the use of a cigarette, I think is probably inaccurate, because, any behavior is caused by a multitude of factors. So the prior exposure may have, some influence, but there's going to be a whole bunch of other things that we have to take into account, not the least of which, kids' social contact. Who are they hanging around with? Accessibility. People talk about, the common liability hypothesis. Well, that's just a fancy way of saying, well, maybe there are other reasons that kids are interested in using these products. They want to thrill, they want to be rebellious, they're just genuinely curious. And it's all of these things that together probably determine, use in the future, and not any one kind of single thing. So that's why I think singling out this, one early exposure is almost a bit of fool's errand to be able to, to make strong claims about it, and even to research it. It's kind of like, you're trying to isolate this one factor, and it's really, a much, much more complex phenomenon.
But there's still many researchers that are out there who speak of Gateway all the time and are conducting research about it all the time.
Researchers are no different than other people. They have to support themselves, and they're going to go to where the money is. And if you can get money saying, I'm going to research, gateway effect, you're going to want to get the money and do the study.
We've hit that spot where pre-interview doesn't match when the camera's rolling. That's okay. I can understand that. I believe the way you characterize it was delusional, could be ignorance, distraction. Scientists really have to kind of stand up and just stop doing this kind of research.
Yeah, kind of strong words, and when I get worked up, I do feel that way. And it really stems from this thing, this idea that I hold, which is, why waste your time on a dead end? This is, you've got talent, you've got skills, you should be, doing something more worthwhile with your time, and it's, we've seen this story before, and especially, and it's not just in tobacco, the whole, marijuana, heroin gateway thing. Where did all that go? And there was a ton of research on that. Well, where is it all today? It hasn't led anywhere. It's just not been a fruitful approach, for any reason except to, do, indulgent intellectual exercises that ultimately, lead nowhere. So scientists, stop wasting your time.
So when you were at Truth, you wrote a pretty well-researched paper, Rethinking Nicotine and Its Effects. Dr. Niaura, nicotine is the demon drug. At least that's what we've been told. What do we know about nicotine, and why is it such a concern?
Well, it turns out we know an awful lot about nicotine. It's probably one of the most studied drugs, ever. We know that it is a drug that has direct actions on a particular neurotransmitter system in our body called the acetylcholinergic system. And this acetylcholine is a neurotransmitter that controls, your muscles, so it controls, how your muscles contract. And so these nicotine receptors, if you will, are found throughout the body. They're in your heart muscle, they're in your other muscles. There are actually a whole bunch of them in the brain as well, and those are the key receptors, because that's where nicotine has its psychoactive effect.
So let's go through the claims. There's the cancer claim. There's the claim that nicotine harms teens' developing brains. So those are the two big ones about nicotine.
Well, so it's pretty clear that nicotine doesn't have a direct effect on carcinogenesis, new cancer. There's a little bit of evidence that it may accelerate the process of cancer if somebody already has cancer. So, an implication of that is, if you've got cancer, probably not a good idea to keep using nicotine. Certainly not a good idea to keep smoking. I would say to people, if you need to use vapor products or other products to get off of smoking, do that first and then see if you can wean yourself off of nicotine. But it's not a primary cause of cancer as far as we can tell. So that's a myth that, unfortunately, is out there. It's almost common knowledge, and again, it's not a real fact. Nicotine does have effects on the cardiovascular system. So, I mentioned before, it'll increase heart rate and blood pressure. And probably over long periods of time, that could add up and maybe, slightly increase the risk of heart disease. But probably, the impact of that is probably going to be much, much, much smaller compared to, if people use combustible tobacco products. The studies that people cite to claim that there's, brain damage, actually they're done with animal models, usually rodents, mice, rats. They'll look for these animals and they'll catch them during a period of adolescence, which I think for a rat is like 2 weeks or something like that. And they'll administer, nicotine in various forms and doses. And they'll sacrifice the animals and look at changes in neural pathways and there are other ways to do this and so forth. And yes, they do find that, things happen to the neurons in the rat brain. But it's not clear what that actually means, or what these changes mean. I mean, brains adapt, this is called neuroadaptation. So, brains are going to do neuroadaptation to any drug. And that means that, some of the pathways might be rewired, and we don't know for, how long these things exist and so forth. So yeah, they have, nicotine has effects. It does things to the brain that can be documented. What these effects ultimately mean, I think that's up for grabs. I think it's a big leap to say, this means brain damage. I just don't get it. Personally, I don't make that leap.
Based on the report that you wrote for Truth Initiative, which was in 2016, it seems pretty clear that you were communicating internally at Truth that concern over nicotine, to the extent that, it's breathless and hysteric, is not warranted. If Truth knew in 2016 of the relative benign effects of nicotine, how could they be out for the last 3 years, being one of the loudest voices, perpetuating some of these misinformation facts about nicotine?
To be fair, they actually encouraged, the development of this particular paper, because, they wanted to kind of explore, the reality. And they had, the paper posted on their website. It's really available for a couple of years. I think it's just, disappeared fairly recently. And as I said, earlier, they've kind of gone, perhaps in a different direction since I left. So I can't really speak to why they're kind of banging on this issue. But, the paper, stands on its own merits. And, I think, there are a lot of folks who agree with what we said. There may be people who disagree. I welcome the disagreement. Let's talk about the points. Let's figure out if there's research to address the points. That's how science advances. We can disagree, but let's look at the data.
Let me ask you this, and back to kind of the theme here of think of the children. Why is it that it seems to be that, that we're wired this way? I know that obviously protecting the kids obviously is important, but there seems to be something more that's going on here.
I think you're right. I think it's easy for people to get on board with, protecting youth. Who doesn't, want to protect youth from, from the world out there? But the tension is, how, you can't child-proof all of life. And kids have to, learn to manage, and, they have to grow up and figure things out for themselves. And, how do we achieve that balance? And, these are issues that are as old as humanity, I think. And we're never going to come up with perfect solutions. But I think it's really easy to just kind of wave that flag and get people's attention and unquestioning, kind of loyalty to the position. And it's very tricky for anyone, and scientists in particular, to kind of say, well, hold on a second here. Maybe things aren't quite what they seem to be. We need to take a closer look. And then, we risk, people saying, aha, you're a scoundrel, you're a rascal, you don't really care about the kids. Well, no, that's not true. But if we're going to be, making big decisions that affect people's lives, we better, out of respect to them and to everybody, we ought to get it right. And, I mentioned balancing kind of the public health standards, making sure that non-users don't start, and making sure that, cigarette combustible smokers stop. That's the balance. And what I would like to say, and I don't know how much traction I'm going to get out of this, is how come we can't do these both? How come we can't do both? Why is it a trade-off, one versus the other? I don't like that thinking. But to me, that's a false dichotomy, and you're getting off on totally the wrong foot. Unfortunately, that's where we are. I'd like to push back against that narrative.
Currently, about 38 million adults in the U.S. smoke cigarettes, and clearly this is and ought to be a huge public health priority. E-cigarettes have the potential to help adult smokers stop smoking. And we've seen evidence accumulating showing that adult smokers who use e-cigarettes can quit smoking regular cigarettes. Studies have come out, for example, in the New England Journal of Medicine, indicating the same. Just last week, a survey reported that smokers who switched to e-cigarettes and used them every day were significantly more likely to quit smoking compared to those who did not use e-cigarettes. Quitting smoking is the #1 health priority for cigarette smokers, and we need to use all the tools available to help reduce this burden, which prematurely claims the lives of over 500,000 Americans every year. I think that this set of issues, both youth tobacco, nicotine use, and adult smoking, have been portrayed as at odds with one another, and they really should not be. And that we in the public health community and Congress ought to find ways where we can do both.